This patient came to see me with issues on tooth number 19. It had a large lesion at the apex and the furcation, taken from the Dexis imaging here. So our Carestream 8100 showed us a very clear 3D bone rendering of this large lesion on this case. So we decided to do this case in one visit, and we used Chlor-XTRA as our main irrigation by Vista Apex, and also SmearOff, which is a 2-in-1 EDTA-based formula with chlorhexidine added. So we used Kerr elements as our instrumentation device, and also Apex located. We used Kerr ZenFlex files as our rotary files. We also used Endo Ultra and activated the irrigation solution. And we used ZenSeal Bioceramic by Kerr, and also we used the Kerr Elements system in this case. So this is our cone fit here, and then this is our completion here, showing very nice case. We brought the patient back in 6 months. Beautiful healing, beautiful osseous healing here, and this tooth was restored. This is the before and after. I talk more about this in my textbook, Endodontic Keys and Cases, available on Amazon.